2020 saw 37 drug-related deaths in La Crosse County and a growing appetite for substances fueled by the pandemic. Tonight, News 19's Mike Biermeister is digging deeper into some of the steps being taken or considered to help people afflicted by addiction.
La Crosse County utilizes a variety of treatment options from office care to intensive outpatient treatment and recovery homes, but no true full recovery center. Building a brand new treatment facility could cost millions of dollars. But Alliance to Heal coordinator Al Bliss believes the community could pursue an easier solution. A navigator who serves as a guide to help people ready to seek the appropriate type of treatment.
A position where a staff person can follow them all along the continuum of care, from the time of misuse of drugs, abuse, to time for treatment, to recovery, and up to including sober living.
Both Bliss and Dr. Chris Eberlein of Gunderson Health Systems say the key to helping someone with substance abuse disorder is getting them the help when they're ready.
Aligning the patient with the right treatment option is always a challenge. So we're working at getting patients navigated through the system to figure out what works best for them.
Bliss believes this navigator position would cost a fraction of the price of a new center and provide people help right away when they need it. Another solution in play, the La Crosse Drug Court program, which has been around since 2002 and helps 20 to 25 people at a time.
In a nutshell, the drug court program is aimed at individuals who are at high risk because of a lack of supports in their life, who have committed crimes motivated by addiction.
La Crosse County has also taken advantage of the Narcan Direct program, which allows community agencies to prescribe this life-saving nasal spray to people at risk for an opioid overdose, free of charge. The La Crosse Medical Examiner's Office reported that deaths would be up 150% from 2019 had Narcan not been available. But Narcan doesn't always save lives. And the Overdose Review Fatality Team analyzes those deaths by interviewing family and accessing other information to search for early warning signs.
Children who are in early middle school, their school counselors, their parents identified that their levels of anxiety were fairly high in middle school. They were doing things like cutting, they were missing school, they were failing. They complained to parents about not being able to keep up and that sort of thing.
Davis and her team relay that information to local schools to help educators look for these cues and work to intervene.
Unfortunately, we're learning from, the folks that we've lost, which is sad, but it has given us a way to at least use their death as a positive.
Now, the biggest question for 2021. Will this deadly trend continue? And how will the pandemic influence that trend? Dr. Eberlein believes things are already starting to turn around.
Patients are more apt to come in than they had been in the past. And so I think in the next 6 months, hopefully we can start to see this trend turn around.
But the more important question may be, how will we as a community change the way we react to someone struggling with substance abuse? In the meantime, leaders like Dr. Kelly will continue to work to connect people to the treatment they need and help them find their footing again.
Recovery is real. It can happen. And these are some of the choices you have when you try to enact that in your own personal life. And in doing so, change your life and the life of the people around you, since it is a family disease.
For News 19, I'm Mike Biermeister.
And you can see both parts of Mike's special report over at our website.